So reproductive technologies should play a very important role in the policy responses to low fertility, particularly because they offer people more options to decide whether or when to have children. Of course, reproductive technologies are limited. They're not always successful, so a minority of people actually have children with them. But the fact that they do offer options to people who otherwise could not have children is important in terms of creating more opportunities for people to make the reproductive choices that fit what they want to do in life. So one of the important things to keep in mind is that it's important that these technologies are available equally. Often you see in more privatized healthcare systems that there are differences in who can afford the technologies and who can't. So if there is provision from state funding for these technologies, that's helpful. At the same time, we also see from the state often quite specific regulations in who can access them and who can't. So it's also important to make sure that those regulations don't limit certain people, such as single people or LGBT people, from making the reproductive choices that are important to them. Another issue that comes up is the commercialized sector for these technologies. So what might happen if there is not a strong public healthcare system in place is that the private sector can create a lot of differences in how affordable these technologies are, and thereby also exclude some people. Or also there are issues about over-treatment and over-medicalization. So for example, if there is too much marketing or too much encouragement for people to use these technologies, some people might use them unnecessarily or undergo more treatments than they really need or than would really be successful. So it's important that people have access to them, but at the same time we need to look at the caveats of who gets included and who gets excluded, but also to look at what the effects are of treatment and if they actually are in the benefit of the intended parents.